from a researcher who has spent time thinking about how we can contain or mitigate the outbreak and hopefully save lives in the process. Say good morning to Edward Kaplan. He is professor of public health at the Yale School of Medicine, a professor of operations research at the Yale School of Management, and a professor of engineering at the Yale School of Engineering and Applied Science. Good morning, Ed. How you doing?
I'm pretty good, Paul. It's nice to chat with you again.
It is so nice to hear your voice again, even if we're not in person. But Harry Droz has your picture up. And how you been,
it's
man?
It's okay, because I never know how to dress for these calls anyway. So we're doing fine.
Well, Ed, I was so interested to find out that, like a lot of us, you didn't know anything about coronaviruses, right, as of 6 weeks ago. But that now you've been really studying it for 6 weeks and doing some really important academic research into the spread of COVID-19, and with the idea of looking at what we can do to mitigate its impact and try to save lives. Did I get that right?
Yes, you absolutely did. There are a number of individual actions which we can all take, which not only are self-protective, but are actually protective to the community around us. And so I'm sure many of you have heard some of these pieces of advice before, but it's really, really important to take this seriously. Because I guess I would even go so far as to call it a myth, but certainly one story floating around is that, there are flu outbreaks every year. And
this is swine flu, right? We're hearing it's swine flu.
Yeah, or some people even say, there's like a couple of years ago, the influenza outbreak was worse than normal. But the fact is that this is a novel virus. Unlike influenza, there is no vaccine, and there won't be for a year. And it turns out that for the 10% of people who, in fact, develop serious infections, serious complications of this is much deadlier than the flu. So it is definitely something that we need to prepare for. We don't have a lot of time. If you take a look at other countries with comparable health systems to ours, Italy is the case that comes most in mind to me. This thing is explosive. It can blow up fast. And frankly, the way we live is likely going to change over the next 2 months. And it's something that
2 months.
Is difficult.
Okay.
It's difficult to think it could take that long for this thing to run its course. It will go better if we do a better job at containment, and that is going to depend on some of the principles I'm about to mention. But I will say, unfortunately, on the negative side, that we really are very far behind the curve in terms of testing and our ability to actually identify infected cases. And we can talk about why that situation happened. But nonetheless, it's caused a situation where there are people who are infected and do not know it, and there are even people who are infected and saw doctors, and it turns out that people didn't know that they were infected.
Like the person who might be in New Haven, they just closed Nathan Hale School. A grandmother was taking care of a kid coming into school, had been to New York, had called the doctor, done everything right, called the city, called the doctor. They said they tested negative for flu, but it turned out that she might have the COVID. Yeah. So, Ed, before we get to those specifics, and I definitely want to speak about the study you did on the first 425 confirmed cases in Wuhan. This is interesting. I want to ask you a real dumb-sounding, overwhelming question. Okay, you ready?
Yeah, go ahead, but I can't believe any question you would ask would ever be dumb.
Here's my question. How sunk are we? We're reading about overwhelmed hospitals in China, Italy. They're having to decide on the fly who gets to live, who gets to die. There are all sorts of projections flying around that, what percentage of population is going to die. How sunk are we going to be in New Haven? I know a lot of it has to depend on these measures we're going to talk about, but is it likely we're all going to be quarantined, that a lot of people we know are going to die, that the hospitals, Yale New Haven Hospital, is going to be overrun? Is that something you think is likely?
What I think is that we're trying everything we can right now to prevent such a situation from happening. And by that, I mean people involved with the hospital recognize what's happened in Italy, recognize what has happened in China, and are actively planning to increase the capacity for dealing with coronavirus infections, the most severe cases, by repurposing the hospital.
What kind of repurposing are they doing, Ed?
Well, I'm talking about basically reallocating parts of the hospital. I can't get into specifics, but the whole point is you don't want to have a situation where you have people who are in need of both intensive care and isolation. And isolation has technical requirements, negative pressure being one of them, meaning that you don't want the air in a contagious patient's room to go outside of the room, basically. So you have to make sure that there's no flow out. That's called a negative pressure room. So you don't want people like this scattered around the hospital. You want them concentrated in one area where they can be isolated, and also to protect the medical staff. So what that means is basically rearranging the space and moving people around and doing it in such a way that you would be able to handle the expected surge in cases that we're going to see.
All right, and now, have you been consulting on that? Because it sounds like you have some firsthand knowledge.
Well, I have been involved in trying to help with the planning. I can't say anything much more specific than that, but what I can say is that some early analysis which I've done suggests that some of the repurposing plans should get us through for the most severe cases, meaning that the situation you're most worried about, which is that the large numbers of people would die, we would be able to be paying maximal attention to keep those people alive first. That's the most important thing. But there are several things that individuals can do that actually will help in that effort. And that's sort of, there's a little bit perhaps of some counterintuitive stuff that I wanted to mention.
That's interesting. So we can actually, you said the hospital's on it, but that they need our help.
They definitely need our help. And here's how they need our help. If you think about it, you know how upset people get if they want to go to a restaurant and they're told they have to stand in line for 2 hours, or, any of this sort of thing. Well, hospitals are really not all that different. There's only so many beds there are in the hospital, and even if you start imagining, as happens in the emergency rooms, which are already quite filled, quite full this time of year because of influenza, you often will end up with cases where you just run out of rooms and people are literally on beds in the halls, and that's not an uncommon occurrence. That's called boarding in the emergency room. It's quite common for patients to be boarded. Obviously, you don't want to be in a situation where you would board a coronavirus patient. That's just not something that you could imagine really doing. You would never want to do that. And yet, in Italy, in the Lombardy region, that includes Milan, so we're talking about a very advanced, very developed part of Italy with a very modern healthcare system. That's exactly what's happening. You have contagious people on gurneys in the hallway because they've run out of capacity. So this is what happens if you don't have the opportunity to plan. And the Italian example is in particular a very sobering one, because I think that's really what set off the alarm bells more than anything else, and has got everyone really rushing to make sure that we can prepare to contain this thing. But let me say something about how the community can help, because I think it's really important. And it might be a little counterintuitive at first. There's no vaccine against coronavirus, but there is a vaccine against influenza and a flu shot, right? Now, it's not that a flu shot will protect you against coronavirus. That's not the point. The symptoms of coronavirus infection and the symptoms of flu infection at the beginning are almost identical. You get the same, scratchy throat, and you get the same muscle aches, and you get the same, congestion, all of that sort of stuff. So what that means is that a lot of people who get influenza, actually the serious influenza cases, end up going to the hospital. And as I said, the hospital has tons of influenza cases right now. But if more people would get flu shots, then fewer people would be getting infected with influenza. Fewer people would hence develop those cases, which means that fewer people would be going to the hospital, which means there would be more attention that could be paid to the coronavirus patients. And furthermore, if it turned out that you had in fact gotten a flu shot, we know the flu vaccine isn't perfect, but if you did get a flu shot and then it turned out that later you still ended up getting sick, that really would raise the chance that it's the coronavirus and not the flu. In which case it tells you that actually, you did everything you could to sort of wipe out the other kinds of risks, and presumably you're also, maintaining to the best of your ability personal hygiene and whatever. But look, It's a contagious infection. It's transmitted, through droplets, respiratory droplets, which is these are very tough kinds of outbreaks to control because you get people in contact with each other, and somebody sneezes or someone coughs or even perhaps touches a surface, and that can transmit. So I guess what I'm trying to say is one thing, maybe even the most important thing people can do to try and alleviate the stress on the hospital is to go out and get flu shots so that you will reduce the non-coronavirus demand on the hospital, giving up more capacity for them to focus on the people who are really going to need it.
We're talking to Edward Kaplan, a professor at Yale in public health and organizational management. And he's been doing some of the cutting line, frontline research on the coronavirus and helping people in New Haven, officials plan for it, including at the hospital. He's joining us generously on Dateline New Haven, WNHH-FM, your home for community radio at 103.5 FM, live streamed at newhavenindependent.org. So just so I understood you right, Ed, you're saying that you think we're probably not going to see what happened in Lombardy region, in Milan, where they had not enough space in the hospital because the planning's going on. You've seen it. You can't give the details, but they're reallocating space so that you can have isolation in conjunction with ICU that doesn't endanger other people. So there'll be enough beds, but you're saying that we play an important role in preventing, and we've heard a lot about flattening it out, the spread of the virus, by doing a lot of extra steps that we can take to try to avoid overwhelming the hospital system. And that includes, we haven't heard this anywhere else, get the flu shot, because even though that doesn't stop coronavirus, it puts less of a demand on the hospitals if fewer people are going there with the flu, and it helps people who still develop the symptoms understand and helps officials understand that they might actually have coronavirus. Did I get that right?
You got it exactly right, Paul.
And I'm guessing there's a whole bunch of things we've already heard that add to your point, Ed, that if we wash our hands a lot, if we keep social distancing, don't get too close to a lot of people, avoid big events, that also obviously will stop the spread from happening so quickly. In the Ed, do you expect almost all of us to be exposed? And do you expect 1% of New Haven's population to get gravely ill?
Well, I don't see any reason why, once infected, the breakdown between people who are develop, mild, so to speak, I say mild in quotation marks, versus serious cases, also in quotation marks, would be different. Although, again, there are things that can be done to try and shift it. It's particularly important for the elderly to follow these social distancing recommendations. It's particularly important for them not to be in crowds, and particularly important for them to be practicing good hygiene and also to monitor their own health, simply because if someone in that who was older and perhaps has other health issues is to become infected, it right away makes for a more serious course of infection, just taking over the whole data. I'm not saying that what happened in Italy is that we are fated to follow that course, but we will be fated to follow that course if people don't take this thing seriously. We have, I will issue the following, and again, I honestly am not trying to sow panic at all. I really apologize if anyone interprets it this way. I'm just trying to be very realistic. I'm basing what I'm saying on the best available data that we have. One way that you can make the comparison is essentially to take these outbreak curves of how many cases have been reported and look at them per capita in different countries. And basically what you'll discover is that these curves all have the same shape for the most part, at least in those countries where we trust the reporting. As we know, there are some countries where it's not clear if all of the infections are being reported. But in any event, leaving that to the side, there's no reason to think that there's a mystery going on in Italy, and there's no reason to think that there's a mystery going on in the United States. And if you basically try and position the curves, you see that we're about 2.5 weeks behind Italy. And that's how fast the infection rates would grow here if we are not able to contain. So the next week or two, these are critical times. It's important for everyone to really change their behavior. And again, it's easy to say it, it's hard to do it. My wife always yells at me whenever I touch my face. Suffice it to say, I get yelled at a lot. But
Should
it's
we all
really
be
hard.
should we all be in quarantine unless it's essential work? I
No,
mean,
well, I would say we're not at that level yet. You'll notice I said yet. There are some people who should be self quarantining. I mean, look,
should we be going to restaurants?
well, so again, I would say you should be avoiding large gatherings. And so the question is, if you're going to go to a place and there's 50 other people in the room, even though, and by the way, let me try and get the logic of this across. It's not so much about saying, well, how easily can the virus transmit table to table? Although if there was a high prevalence of infection in the population, that really would be a concern. It's more a matter of saying, what's the chance that anyone infected unknowingly walks into the room, right?
Mm.
And so if I'm in a group of 100 people, right now, I would say there's a very low probability that there would be an infected period right now. But I think that is really changing, and that's going to grow.
If you ran an office, would you plan a going away party for someone with a dozen people at a restaurant for next Thursday?
A dozen people for next
A going
Thursday.
away meal.
Yeah, I'm very risk averse. I would say no. I would not do that at this point.
Okay,
I
so we're
would.
gonna have to
I,
rethink things here. That was not a hypothetical question, but we are posing the questions to Edward
yeah. Well,
Kaplan.
look. Can I just say one
Yeah.
other thing about this, Paul? Because I think there's a bit of a misconception. Some people think that if you were going to have some kind of event of 100 people, and you said, maybe. I mean, I'm not talking about a wedding or something, but I'm thinking more like, there's a seminar or some kind of a thing at work, and say, well, maybe what I can do is instead of having this thing with 100 people in the room at a time, I break it down and I have like 5 groups of 20 or something. That's actually not really doing anything, because although each individual group of 20 is going to have a lower chance that somebody would be infected in a group, over all 5 groups, you're basically recreating the same risk.
Okay, now I'm getting real non-hypothetical. Let's say someone close to you is dying, and you're planning a funeral in Westchester, but not in New Rochelle. Would you, and you think it's probably going to be Sunday or Monday, would you
Uh,
make it outdoors graveside and try to limit it to 20 people? Would you feel comfortable then, or do you think it's still too risky?
this is such a hard kind of a question, which becomes very, very personal. And by the way,
And that's not hypothetical either.
no, I understand. I understand. Look, if a loved one of mine died, I would not only for emotional reasons, I would feel an obligation to do this, because that's my, these are my beliefs in life, as you know. Um, and so, in some sense, there comes a point where you really have to balance out this this risk of a potential infection from someone unknowingly being there versus things that you just feel you have to do.
But you can
I
plan it in a way to minimize the risk. Like I'm thinking if
oh,
you're
of
outside,
course, you can't be too cautious in this scenario. So
so
I
if you're
agree with.
outside and you limit the
And I
number.
mean, I can give you just one other crazy example of this. All right. So in New Rochelle, right around the time when they discovered this cluster of initial cases, it turned out that one of the kids in the school there, it was supposed to, be time for his bar mitzvah, and this is something where there would have been, 200 people coming or whatever. So what did they do? They actually ended up doing the entire thing online. They
Wow.
connected all the school kids up. I don't know if it was Facebook or Zoom or what. I have to say, in spite of the fact that I do a lot of math, I'm really quite the Luddite when it comes to this social
Yeah.
media stuff. I
And
don't
actually,
use
we
it.
have a big, where I go to shul, we are planning a double bat mitzvah this weekend. And I think some of us are planning to go, but trying to keep social distance, do the hand wash. Who knows? Maybe these are tough decisions.
They're tough decisions, and I mean, it's really, it just is an issue. There are just churches and synagogues and mosques, and people who regularly have, like, I know there are people like groups of 20 who regularly get together to play cards, and all of these sorts of things. Uh, that's why I'm saying we have to kind of change the way we live. The good news is that you won't have to change forever, but it is going to be hard for people, and a lot of
Hmm.
people kind of go through, I think, a situation like this, where you say, well, it could never happen to me, or, you can't worry about being hit by lightning. You have to live your life. And of course, that's true. You do have to live your life. But you can change the way you live your life. And the fact is, we're much more able to keep in contact with people who we care about and love without having to be physically next to them now than was the case many years ago.
And we're hearing
So,
some of that advice from Edward Kaplan, one of the leading scholars right now studying the spread of the COVID-19 virus. He is a professor of both public health at the Yale School of Management and operations research at the Yale School of Management, not to mention engineering at School of Engineering and Applied Science. So, Ed, I've been taking too long to get to what you actually studied. You wrote a paper based on a study of the first 425 confirmed coronavirus cases in Wuhan, China. You effectively, where they isolate patients with COVID-19, as the virus has been named, should be sufficient to quell new outbreaks. So what did you study in that? What did you learn? And what should we take from that?
okay, so the study was asking whether or not it was potentially possible to contain it. Is there actually a case to be made for containment here, or would the infection be at such a high rate that basically none of this stuff could possibly work? And so the most important finding was this. First, if you take a look at when a person becomes infected, so let's call that time zero, all right?
I'm sorry, Pine, is it P-I-N-E?
Say it's T-I-M-E,
oh,
right.
T-I-M-E.
So a person becomes infected at some time, so we'll say that's the moment of infection.
Oh, time, okay. Sorry.
So over the entire time that person remains infected, if there were no interventions at all, if the person didn't go to the hospital, basically it could be a person gets infected and doesn't develop severe symptoms, and so they just think, I've got the flu, I've got a cold, whatever, I'm not going to do anything about it except what I would normally do, drink a lot of chicken soup, whatever, you get through it. So during that time period that you're sick, and even before you're sick, by the way, because this is a key part of it, you can be transmitting infections before you have any symptoms. You would infect on average between 2 and 3 people. Okay. Now that tells you how infections spread. If each new person infected, that's one person, can infect between 2 and 3 people, you see how it works.
Right.
Okay. So now the question is, how do you stop that from happening? So the best case is something like this. A person gets infected, they don't know about it. This infection curve starts happening. They start transmitting the infection. They don't know about it, but then all of a sudden, after a couple of days, you start to feel sick. This is, in epidemiological terms, something called an incubation time. How long from infection until you have symptoms, okay?
Mm-hmm.
And it turns out that the data showed that it averages about 5 days. A little more than 5 days on average. Now there's variability around that, but about 5 days. So the idea was, well, suppose it turned out that the moment people got symptoms, they recognized that something was wrong, and at that point in time they were isolated. They could be isolated because they went to the hospital and were put in an isolation room, or they could just stay at home and quarantine. But the idea is, suppose that from the moment you had symptoms, you just cut yourself off until you got better. Then how much would you cut the transmission by? Okay. And the answer was about 20% of all of the transmission happens before symptoms and 80% happens afterwards.
Oh, wow.
So,
I didn't realize that. Okay.
So you would, in the best case, be able to stop 80% of transmission. And in doing that, instead of each person then infecting about, whatever I said, between 2 and 3, on average, each person would infect half a person, if you get what I mean. So, like,
Right.
it would take 2 people to infect one. And that would be enough to actually make the disease go away. That would, instead of infected persons multiplying, they would be cutting it back.
It's like a birth rate, right? We always say if 2 people produce fewer than 2 babies. Yeah.
It's like you go from a positive birth rate to a negative birth rate. The population is going to start declining. And the population, in this case, being the population of infected people. All right, so that's the best case. But the problem is, it's a best case. And, in the early Chinese data, it took people another 5 days before they went to see a doctor. All right. Now, remember, this is from a time when no one had a clue what was going on. People were just getting sick. They didn't know that it was a different infection. They didn't figure that out until later. Because it initially, at the beginning, it kind of looks like flu, right? And then people go in and Oh, by the way, here's another interesting thing about China, which was shocking to me. What percentage of people in China do you think get flu shots?
I was going to say low, but I'm sounding like it's going to be high.
No, it's ridiculously low. It's
Okay.
like 3%.
Okay.
It's really, really low. And so, what that means is that, yeah, they're sort of used to getting lots of flu cases in the hospital because nobody gets vaccinated against it. So what that means is all these people earnestly coming in, the idea that it was something other than flu. It took a while until all of a sudden people started saying, wait a minute, these people are kind of way sicker. What's going on here? All right.
Wait,
So
do they get flu shots in Italy?
I'm sorry?
Do they have a high rate of flu shots in Italy?
That's a great question, and I don't know what the answer to it is. But it is clear that in Italy it did take a while before they really recognized what was going on. I could be wrong about what I'm about to say, but I believe the initial cases in Italy were people who had been in Iran and came back to Italy.
Oh, okay. I remember reading that in the Times. Yeah.
I think that's where they came from initially. And again, it's important for all listeners to realize there's no malice and no intent in anyone's behavior in this. People didn't know they were infected, and
Right.
This is what happens. Okay, so but back to the China story. So what I said was, it's too optimistic to think that people would recognize and isolate right away. So I said, let's come up with a pessimistic case. Let's say that it takes twice as long. So it's like if it took you, if you started feeling lousy after 3 days, you don't do anything about it until after 6 days. Or if you started feeling lousy after 5 days, you're not going to do anything about it until 10 days, something like that. All right? That's kind of a pessimistic case, and it turns out that pessimistic is actually the right word, because if you then figure out, going back to that original idea, what percentage of infections can you prevent, it turns out that you can't prevent enough of them and you can't contain things. So, by the way, that tells you that the most important lesson out of this is really rapid detection. And the most rapid detection you can have is self-detection. Self-detection, which is this is the whole monitoring aspect of it. Okay.
Mm-hmm.
Now, how does testing play into all this? Testing plays into all this because the only people who were getting tested were people who were already at the hospital or coming in and are actually, showing some symptoms. And it turns out that there are two problems with the testing. There weren't enough tests, and there were problems with the reliability of the test. They weren't always giving the right answer at the beginning.
Mm.
So now you have a situation where, first of all, not everyone can get a test. And secondly, even some of the people who were tested, who were infected, were getting results that said they're not infected. Both of these things are now being addressed, but we're still way behind the curve. Just as an example, I can tell you in Connecticut, I'm looking right now at a web page for the state of Connecticut. As of yesterday, the total number of people who had been tested, according to the state health department, is 74. Of those 74 people, 3 tests were positive and 71 were negative. One of those 3 people could not be traced to any known exposure, and I believe that's the event that triggered the public health emergency, because the fact that
the first in state, it wasn't someone from New York, right?
Yeah, it's not like you could say this was somebody from New York or this was someone who, was exposed in a hospital, but we know who they were exposed to. This is a case of someone where it's kind of like, I have no idea. You talk to the patient, you interview them, you try to figure out everywhere they've been over the last 2 weeks, and there's just nothing that comes out of it that is indicative of any exposure. So that is, in some sense, the definition of what we call community transmission, which means that there is a virus circulating in the community, and that's when more severe measures are appropriate.
We're talking about the coronavirus. Just want to let people know what they're listening to. Edward Kaplan is a professor at Yale of public health, operations research, engineering. He's doing some of the seminal study of how the coronavirus outbreak spread from Wuhan. And he's doing some work right here in New Haven to try to prevent a lot of us from dying. And we thank him for that and for giving us some insight. Ed, you were one of 3 Yale professors who were interviewed yesterday in an article or quoted in the Connecticut Mirror about if and when we should close public schools in Connecticut. And what was interesting to me, Ed, is that it's not that you contradicted each other, but at least as it was presented, you three had very different takes on it. So Nicholas Christakis, who does all the great social network research, he said he's going against what he usually thinks about the importance of contact. He says that based on the study of the 1918 flu outbreaks, cities that closed schools fastest had fewest deaths, he thinks we should close all public schools now. James Meek said there's not enough good data to make that decision with relevant cases because kids might not transmit it. And then you said, you didn't contradict them. You were quoted saying that there are unintended consequences. Like on the one hand, kids could spread it to adults if they don't realize they have it. But on the other hand, if they're kept home, they could spread it to grandparents who are caring for them. So should New Haven, they closed one school, Nathan Hale School, because someone who'd been in contact with the virus and was sick was taking care of a kid, had been in the school. And then we're immediately hearing from other teachers, well, the teachers at that school were just at a training the day before with teachers at Betsy Ross School. And there's a whole debate going now in New Haven. Is Christakis right that we should just close the schools now and that's going to have the biggest impact? Or is Meek right is we don't even know if that'll help at all and that's too hasty?
So my feeling is that this requires some nuance. And the recommendation that I had was at the soonest possible moment, which should have been several days ago, the school superintendents and the health officials on a district by district basis really need to talk about this. Because the real issue does have to do with the comparative risks of the two scenarios. So, some things that I also feel, and again, I was very pressed for time, so I didn't get into all of this detail, but there are other issues with sending kids home. What happens if the kid who you're sending home from school is the child of a single mother who is also a nurse, for example? What happens if there is, in some cases where people are literally living paycheck to paycheck, there might be no one who can actually watch out for the kids, and it could be that they encounter risks from infection or from just everyday life, which could be greater than the risk of being in school. I mean, I guess what I would say is that for some subset of the students, school might be the safest place in the world for them.
Right.
So there are issues about people who rely on schools for their lunches.
Right. And they're dealing with that in New Haven. They're talking about how to get the food to the kids. And I guess the question is, even if school's safer for the kids, is it less safe for the whole community if they're there, right?
Right. So my feeling is that this is why I think it needs to be a local decision where you can basically weigh the pros and cons. However, I also think that an outbreak like this could move at such speed that in some sense the infection imperative, within a relatively short period of time could end up overwhelming everything else. But it's important not to lose sight that there are all kinds of non-infectious but nonetheless risks to the kids, which could be worse if you send them home than if you hold them. The infection transmission part seems pretty clear. And also, I do think there is this issue of, if you have a subset of kids who are basically going to be cared for by elderly grandparents because that's the only way that the parents can continue to work, things could get worse. Because the question is, are the kids at home actually going to stay at home, or are they going to go out and wander around and play and who knows, end up picking up an infection that way? So, and then coming back, as you said, or as I said, and possibly transmitting it to
so when is the moment? Like if you were there and you were yesterday and you were told, maybe were you aware of this thing with Nathan Hale School? Like would that have been enough?
I haven't been part of any of these school discussions. So I wasn't aware of what was going on in New Haven. Again, it's just so difficult, and I really think that you have to kind of make the right decision. I would need to know, okay, the epidemiology side of it seems at this point pretty much the same across the state, given the information we have. It's not like I can say on the basis of three states, the three cases, we got a hot spot in Hamden, but in Litchfield everything's okay. I mean, I can't think of it that way, basically. And frankly, I have a hard time even disconnecting Connecticut from New York because
Right. So what
New
would
York,
you? So do you know what you would do if you were in charge in New Haven?
I would probably try to say, is there a period of just a very short few days where we can work out all the logistics so we can make sure that the kids who are getting services in the schools, what they absolutely have to have, and that would include things like being fed and security related things, and just give a chance for those arrangements to be made. And then when it's never gonna be perfect, obviously, but when you're satisfied that basically people will be safe at home, then I'd pull the trigger. But I
So it
think,
sounds like they're doing that, Ed. They have the teachers off half day Sunday, Monday to come up with plans for distance learning. They're
yeah,
working with the United Way to make sure food gets to the kids. So it sounds like they
yeah,
might be working on the Ed Kaplan model. This is going to be happening probably. Let's be ready and let's look out for the kids and take a little time.
it sounds like it's the right thing to do. But again, just to sort of emphasize that, you know, obviously different communities are going to kind of come down on different sides of this thing in the short run. In that same Connecticut Mirror article, there was a very interesting map. I don't know if you had a chance to see it, but basically it's a real time sort of update on who's closed schools and who hasn't closed
Yeah,
schools. And
yeah,
so it's sort of like, you go to New York just below the Connecticut border, and you have this whole belt of
right.
schools in New York which are all closed. Then you cross over into Connecticut, and all of a sudden it's not so. But of course, New York declared a state of emergency earlier than Connecticut did,
Betty
and
Green is listening to the show, and
you
she
know,
asked, "How will people know if they're not tested? Look at the number of students and staff that have possibly been exposed in their families." Betty, thank you for listening and for the question. We'll get to one or two others if we have time. So Betty's asking, given that people have been exposed, we don't know how many. I get the sense Betty's saying, wouldn't you want to pull that trigger ASAP?
so again, the question is, I understand Betty's reasoning. The question is, would you end up causing more harm than good in the short run if you don't have your preparations ready? It becomes a
Mm-hmm.
bit of a gamble if you say, look, that's it. We haven't finished preparing, whatever plans you wanted to send home with the kids so that they have school-related activities that they're going to be involved with over the next 2 months, because it could be this long. I mean, it could be that for 2 months the schools are closed. Um, not everybody has access to online stuff, and then again, there's the very essential, of the moment things I was talking about before, like being able to have lunches and so forth. So to me, it seems that if you have an individual case where you're worried that there's been an exposure, it would certainly make sense for that kid to be held out at home under a sort of self quarantine kind of thing, because that's what the advice is when a person is traced to have had a known exposure, even though they don't show any symptoms themselves. The advice is that they should self quarantine. And in fact, just as an example, at Yale, anybody who is returning from a country which is considered to be at higher risk for this, countries like Italy, countries like Korea, countries like China, countries like Iran, we have Yale people all over the world. People are coming back, and they are being told, if you're coming back from any of those countries, that you should stay at home, you should self-isolate for 14 days, and there are instructions on what that means and how to do it.
And
So
Bob asked about the NBA, Ed. What do you think about that? He says, what about them canceling games when one player had the coronavirus in Utah?
it's an abundance of caution, but I think it's a very important thing to do. It's important because all of these events create large crowds, and the crowds are exactly the places where transmission like this could most easily occur. You have a lot of people who are packed very close together, and the fact that you might have 10,000, 15,000 people at a game means that a couple of people who are infected could easily be part of that crowd, and you're just going to amplify everything. So I actually think that it's really quite a decision that the NBA commissioner made to do this, but I think it's very much the right decision to do it. Uh, that it took the infection of a player to be the triggering event as opposed to just general crowd contagion concerns. You can get into arguments, but the bottom line is for a business as big as this to do this is, I think, quite an important signal. And again, it just tells all of us how important it is to to avoid crowds, to basically, do all of the things we've been talking about.
Ed,
Hygiene, hand hygiene, 20 seconds at least, hot water and soap, monitoring your own health. If you feel that you're coming down and it just feels like a cold, you should stay at home. Don't go to a doctor without checking first if it's okay for you to come. If you walk by the Yale Health facility at 55 Lock Street, there is a sign before you come into the building that says, if you have a fever or a cough or a congestion, don't walk through this door, call this phone number. And because it's important for the health facilities to be ready to receive a potentially infected patient.
Ed Kaplan, when I
So,
look at your background, I'm really impressed with how you are the man of the moment because you've done public health research, you've done management operations research, engineering statistics, which are so crucial here, and you've written books on AIDS, HIV prevention, and spread. Do you have relevant takeaways from your research in how AIDS and HIV spread with, to come to bear here, even though every issue is different?
so, that's a great question. The part of my HIV work, which is, I would imagine, most relevant to your viewers, is the work that was done right here in New Haven with the needle exchange program.
That was
And,
fascinating. Yeah. Robert
and
Heimer. Yeah.
30 years ago, it's more than 30 years ago now, really. That was in, 1989,
We're getting old.
1990.
I remember that like yesterday with Jonathan Parker and then Robert Heimer's
That's right.
study. Yeah. I
Right.
remember those
Al
articles.
Novick, of course, and
Yeah.
and Lane O'Keefe, and just so many important people who were involved in that. And we all felt that there was a real opportunity to preserve lives here. But the thing that was is as intense as that experience was, and with regular meetings and getting people from the community, ranging from the clergy to the police department to people in drug treatment, all of these different groups involved to try and put together a service that would work. Um, you were doing it in a sense where it felt urgent, but it wasn't like this. It wasn't like with HIV then you felt that, there could be an increase of 10% per day or
Yeah.
something.
Yeah.
That was at the very beginning of this coronavirus thing. That was kind of like what we were seeing in China. So as I said, six weeks ago, I knew nothing about this. And in fact, look, it's in a sense a total accident that I got involved in this in the first place. I got an email one day from the editor of a journal saying, we're starting this a new department called Current Opinion, and we'd like you to write something for us. And this is sort of a health operations thing, so it's sort of right up my
Which journal
alley.
was this?
And you said, it could be about anything you want. And I'm thinking, do I really want to do this? I've got all these other things I'm already working on. And then later I said, let me think about it. And literally 4 hours later, something like this, I see there's this new article in the New England Journal of Medicine about what's going on in China. And I start reading this paper, and as I'm reading it, I'm thinking, oh my God, they actually are telling me what the exponential growth rate is in infections, and they're telling me what the incubation time is, and they're telling me, how much time goes within a transmission chain, one person infecting other people, how long from when the first person got symptoms until the next person got symptoms, and so on. It's like, wait a minute, that's exactly the information you need to say, oh, is it possible to contain it? And so literally on the spot, I started doing some scratches, and I said, I think I can actually say something that might be helpful about this. And I put it together and sent it out, and it's getting reviewed. And meanwhile, I shared it with some colleagues around here, and the next thing I know, I'm considered one of the coronavirus experts. When it's something where I've just learned on the fly everything. So there is a pressure, and with it a certain amount of stress, I have to say, about kind of doing something like this in real time, because going back to the needle exchange, it was very, very important but over a period of, say, a month or 2 months or whatever, to kind of get the thing up and running, and then following, an evaluation that initially lasted 6 months and then went on to inform decisions and thing. But over the whole time frame of the thing, it was, you could kind of think clearly and not feel like, if I make a mistake today, I'm going to pay for it tomorrow.
Well, Ed Kaplan, that is an amazing example. You are an amazing example of how academic research can play such an important role in everyday real life for so many people. You are an example of what we call Pikuah Nefesh, saving a life, no more important imperative in our existence. Ed Kaplan, we're lucky we have you in New Haven. Thank you for the work you're doing to help us understand the spread of coronavirus, and the work you're doing in New Haven and studying from China, so that we can try to get a handle on this. And thanks for joining us today in Dateline New Haven.
Paul, thank you so much. And really, we can all get through this if we just all do our part.
Your lips to God's ear. Thank you, Ed Kaplan. Thanks, everyone, for joining us. Thanks to the miracle man behind the controls, WNHA station manager, Harry Droz. We're going to take it out with the Afro-Semitic Experience, performing I Wish I Knew How It Would Feel to Be Free from the group CD, A Plea for Peace. This is Paul Bass, inviting you to fly free with us all day and all night on WNHH, New Haven's home for community radio.